You're meeting all of us, right? We don't have to meet ourselves?
Good evening and welcome. My name is Gideon Hanuman Singh, here to moderate a 90-minute virtual discussion on the topic COVID-19 vaccination. Can it alleviate mental health, brain fog, and depression and help end the pandemic? The University of Trinidad and Tobago has assembled a distinguished panel of experts who will share their thoughts, engage in an open discussion, and at the appropriate time, will take some questions. Now, this is a topic that is gaining the attention of countries worldwide as the impact of this cloud of pestilence, as I call it, spares no nation on the face of the earth. And with the Delta variant here, according to the Ministry of Health, the reason for vaccination is even more urgent. We're hearing that this strain of the virus can infect at least 8 persons in a short space of time. In other words, it's like chicken pox. So be prepared, get vaccinated. It has ignited a difference in humanity. COVID-19 has changed our lives and our lifestyles. It has taught us discipline, but a dangerous side effect is hesitancy, reluctance, I dare say, to accept science, and much to our peril. But don't let me be the prophet of doom. So let's hear from our professionals who will give you all assurances that vaccination is imperative. On the panel this evening, we have Dr. Nicole Ramlachan, geneticist, Associate Professor, Biotechnology, UTT, psychologist, Dr. Margaret Nakid Chatur, Assistant Professor, Center for Education Programs, UTT, psychiatrist, Senator, the Honorable Dr. Varma Diyal Singh of the Barataria Community Mental Health and Wellness Center. And we begin with neurologist, Dr. Anil Ramlakhan Singh of UWI's Faculty of Medical Sciences. Good evening, doctor, and welcome.
Okay, good evening, everyone, and to this distinguished panelist. So I'm a neurologist, and I work at Port of Spain General with the Faculty of Internal Medicine with UWI. And I'm going to talk today about some of the things that we see in neurology as a consequence of COVID infection. Now, so if we could move to slide 2. And really, when you're talking about COVID, you can look at 2 types of infection. There's the acute infection that hits the papers and everyone sees and results in hospitalization and some quite severe side effects. And then there's the more chronic infection, the long COVID, which can be very debilitating in the people that it does affect. So can we move on to the next slide? So I'm really going to go through 2 cases. Just with the acute COVID-19 infection, and to sort of highlight the severity of this illness and how it can affect people. I'm really going to be talking about 2 patients that were previously well and were young as well. So the first one is 34 years old, and he's a man, and he actually presented to hospital with pain. So the symptoms started off as a pain syndrome, not your typical way, and just an abnormal sensation on the skin. So as part of the sort of becoming routine now, the routine testing is COVID-19 test was positive. Next slide. the thing is that he did have symptoms elsewhere as well. And apart from the initial pain syndrome, he was soon developing hypoxia and he required supplemental oxygen. He was managed as COVID-19 in hospital and treated as per standard. But then 1 week into his illness, he's still getting a lot of pain, but now he's developing quite severe headaches and sharp pains radiating down the right side of his head. And something's gone wrong with his vision as well. His vision has changed. Thanks very much. And he just doesn't seem to be seeing things on the left-hand side. And remember, this is a previously well individual. He's also noticing some pain on the left side of his body. And these symptoms really evolved very rapidly overnight and were persistent. So, you know, clinically, this does look like a stroke, and it's in the setting of a COVID-19 infection. The symptoms that he has isolate to the right side of his brain, and we can't find any other reason for his infection. So, for example, a spinal tap or lumbar puncture is done, echocardiogram of his heart, and ultrasound of the main blood vessels to the brain. They're all normal, leaving COVID-19 as the only identifiable cause for the stroke. So essentially, this man, he has had a stroke. And one of the things to emphasize here is that he was previously well, and COVID-19 was his only identifiable risk factor. So what do we know about this? Well, we know that 1.3% of patients with acute COVID infection will have an ischemic stroke. So they'll have the type of stroke caused by clots in the brain. There are risk factors for it, like hypertension, diabetes, atrial fibrillation or abnormal beating of the heart, and heart failure. But if you look at the acute COVID syndrome, it's noteworthy to see that a certain percentage of people, we think it's about 1.3%, will suffer strokes. So, you know, while we hear all the news about the vaccine, we are also seeing that in young people and in people without any who were previously well, without any comorbidities, they too can suffer strokes. Can I see the next slide? So this side just sort of looks at what to expect neurologically in COVID, in the acute COVID-19 infection. And when you really look at the total amount of people with neurology, that amounts to something about 13.5% will have neurological symptoms. And most of that is because of the fact that they are sick. There will be toxic and metabolic causes for the brain just not working properly. Like I said before, stroke is common, but you also see seizures, hypoxic brain injury, because they are just not getting enough oxygen in through your lungs to feed the dependent organs like your brain. And you can also see other conditions like movement disorders, nerve damage, muscle damage as well, and severe weakness called the Guillain-Barré syndrome. Thankfully, we have not seen conditions like encephalitis or seizures or myelitis, where the spinal cord becomes inflamed in COVID-19. But it's clear now that there are a lot of neurological side effects in acute COVID-19 infection. But it's not limited to that, however. And if we can move to the next slide, we can see that his mobility, you know, he's getting there, but his vision remains abnormal. And thus far, it is behaving as if he's had a stroke, although all we can find in this man is the COVID-19 infection. So if we can move to the next slide. So if we look at the chronic COVID. So these are the people who recover from COVID infection. They recover from the lung disease part. They recover from the renal disease. They recover from the liver disease. But the neurological sequelae is not always so reversible. So let's look at this case. So we have a 24-year-old male. Again, he's normally well. He works in our office. This could be anybody really. He develops flu-like symptoms. He gets a fever and he becomes hypoxic. And this is what results in his hospital admission. And he tests COVID-19 positive, and he's managed in the routine manner. So next slide. But during the hospital stay, he now develops severe headaches. He has blurred vision. His vision is so severe that he's unable to see things clearly. His vision is graying out. Things look very gray. He's unable to read because of this. Now, the important thing to say here is that these symptoms are variable. So sometimes he can see clearly, but if he concentrates, when it's important for him to function and to read, he just cannot read properly. He notices that he's developing dizziness and unsteadiness when he's walking. Next slide. And really, he recovers from his COVID. So 2 weeks after the infection, the chest symptoms are resolved. He's no longer hypoxic. He did have renal impairment, but he's better now. But the neurological symptoms continue. So next slide. He's getting severe daily headaches, his entire head. He's getting throbbing pain, difficulty to concentrate. And he tries driving, but he's just not able to. Every time he does anything that requires excessive cerebral or brain activity, he gets symptoms. He gets headaches, he gets blurred vision. So what happens? He ends up working from home, but he just cannot use his computer anymore. He cannot read, despite his vision being normal in between. Next slide. And so this is partially the main concern here. So the cause here is undetermined. MRI scan of the brain and the eyes are normal. His eye assessment is his eyes physically normal. Blood investigation, spinal tap are all normal. And so the question arises, what do we do for this man? Well, I'm afraid it is supportive care to try and support him as best as possible through his vision problems. Next slide there. So by 3 months now, he's not sleeping, he's unable to drive. His headaches are almost daily now. They're refractory, they're not treatable essentially. But for him, his vision is his main concern, but because he cannot work, he's unable to drive, and his vision is continued to be impaired. So he moves on to 9 to 12 months later. It's taken almost a year, and things are now returning to normal. His vision is improving, and he is back out to work. His driving is still a problem, but it is getting better. And if we can advance one more, and it's just to emphasize that no other diagnosis was made in this man other than the COVID-19 infection. And this guy was essentially normal before. So the final diagnosis here is long COVID. It is the sequelae or the complications of COVID-19 infection. He's finally reviewed about a year and a half from his initial diagnosis of COVID. And he's now much better, returning to normal level of functioning, but it's taken him a long period of time to recover from his illness. So neurology and long COVID, well, what we do know is that it affects young people. These are young and middle-aged people that are affected by this condition. It is not trivial. Most people are women, and there is common comorbidities of depression and anxiety or autoimmune disease. Autoimmune disease like lupus can predispose you to this. What is important here is what I've put in bold, and I know we're going to talk about this later on as well, is this issue about the brain fog and the fatigue. And, we're talking about 81% of long COVID neurological sequelae being this brain fog and the fatigue that people just are not able to get out of. They also get a lot of headache, a lot of numbness. Anosmia is inability to sleep, and myalgia is pain in the muscle. And it just goes into in combination with all the other symptoms. And what results is you have a patient or somebody in front of you that is not able to function in society anymore. And they take a long period of time. And these are young people as well. Can I see next slide? So just a word with respect to the neurology and brain fog and fatigue. It is difficulty with concentrating, with difficulty with decision making, and to emphasize the loss of confidence that goes along with this condition. The loss of drive and interest in things, and the extreme tiredness with just the smallest activity resulting in quite severe fatigue, so much so that you can't do anything for the entire day. The household fall apart. People aren't able to function in any way possible, and some people have lost their jobs because it takes such a long period of time to recover from these conditions. Let's see, next slide. So really the take-home message is that COVID-19 infection commonly causes neurological complications. And when we're talking about long COVID, fatigue and the very difficult condition, brain fog, is very difficult to live out of. But more severe complications like physical conditions like stroke can also take place. And these things happen in patients as well, patients without comorbidities, but of course are more prevalent in patients with comorbidities. Let's next slide. Just a brief mention about the whole rest of us, about how the rest of the population is being affected by what is happening with COVID and COVID patients. Well, we are seeing our friends, we're seeing our relatives, we're seeing our cousins, our brothers and our sisters affected by this condition. We're seeing them losing work and the economic implications. And there is a definite mental and psychological impact from being on lockdown, being on not being able to see people, not being able to socialize as you normally would. Just to say the mere fact that you have to wear face masks on day-to-day interactions with people, that too has a mental effect. And the effect can even be doubled for the children who are resulting in having to have homeschooling and the severe isolation that can be associated with that. Places like Japan, they've seen their rates of teenage suicide going up dramatically because people or children are having to be homeschooled and are in isolated environments. So COVID, without being infected, is affecting all of us essentially. And just the last slide for me, the long-term implications can be hard to tell, but the impact of COVID-19 is on all of us, and the neurological manifestations are real with respect to the acute infection and more so for the chronic infection. So neurology and COVID, they do go hand in hand, and but hopefully with the correct management, we will find our way out of this pandemic. So I think I'll be on the panel and I'll be here to answer any questions later on. But back over to you.
Thank you most kindly, Dr. Ramlakhan Singh. Appreciate your contribution and looking forward to your additional intervention. Quite naturally, from the very start, we can say that this is an attention grabber, the information that you shared, and particularly talking about the mental and psychological impacts, which leads me to the introduction of Dr. Margaret Naked-Chatur, a psychologist and assistant professor, Center for Education Programs at the UTT. Good evening, doctor, and welcome.
Good afternoon. So good evening to all of our viewers, my fellow panelists and moderator. In my presentation this afternoon, I would examine the mental health and COVID. What are some of the global and local patterns that we are seeing? A proposal for a 5-step plan and the coping strategies for persons who have been affected by mental health challenges. Now, research has shown that the outbreak of the coronavirus has been stressful for many people. Prolonged stress, boredom, social isolation has led to a higher number of mental health conditions such as fear, anxiety, sleeplessness, overwhelming feelings of helplessness, and strong emotions, sometimes negative in both adults and children. The disruption in our daily normal routines have created symptoms of stress, and some of these include for persons irritability, anger, loss of appetite and poor sleep, chest and back pains, headaches, lack of energy, digestive problems, and a lack of motivation. So that there is no doubt that the coronavirus has affected everyone's mental health in some way. A look at this chart alerts us to the influence of factors such as, if we look on the left-hand side, all these factors that can increase anxiety, depression, and stress. On the left-hand side, we see social and physical factors, such as a lack of knowledge of what the disease is really all about. Economic problems that some persons may experience, such as a lack of a job, reduced salaries, and changes in their physical routines, their sleep and nutrition patterns. We also have on the right-hand side of your screen the emotional challenges that some persons may face. The lack of exposure to psychological coping methods, many persons who are unable to adapt in the face of many changes that are happening in our society currently, and the impact of social media sometimes, which negatively affects how they perceive things. What about those persons who have been quarantined and look at life differently? Overall, fear and anxiety for health and for the health and safety of one's family. When we look at the global patterns, it suggests that persons are more likely to attend to certain factors before their mental health that they consider to be important, such as family safety, the economy, job security, salary reductions, etc., before their mental health. However, in Trinidad and Tobago, I have not seen that pattern. As team lead for the crisis intervention team of the Association of Psychologists, from March to July, especially last year, 2020, when everything was at its peak, we saw mental health problems as the umbrella under which many other things were affected. So what we saw was a population affected by a pandemic mentally and having to make changes whether they liked it or not. And some of these changes were to look at their family safety and health in different ways, job security, job loss, and online schooling, similar factors to the global patterns, but in different ways. So between that period, March to July 2020, we had more than 1,000 calls most of them, 70% of them being female. And what was interesting to us was the elderly, 45% of them who called in because of the impact of social media that told them that they were the first ones to die. We had parents calling us about teenagers and online schooling, managing on reduced income. So when we looked at family safety, during this time, the majority of our callers of frontline workers happened to be nurses. They talked about changes in their productivity, absence from work. Some of them would get in their car, drive to work and turn back. Many of them started to consume alcohol, sleep disorders, restlessness, and crying spells. We also had parents who called in to us about family members who were not listening at that time to the protocols set in place. Their children and teenagers who wanted to get out of the house and missing their friends. Older members who were living alone in their families, separated from their children, not only in Trinidad, but abroad, and social media's negative influence. And what was interesting were germophobic persons, relatives calling us about these people who were hypersensitive about washing and sanitizing to the extent that it was destroying relationships in families and upsetting households. And the third dynamic on family safety was online schooling. Now, many parents called in about that because they were unsure of how to juggle the different roles that they now had to do as parent, as teacher, excessive crying in very young children, thoughts of suicide ideation in teenagers, many of their children having now to sleep longer hours and unhealthy sleeping habits, and of course, online schooling fatigue. So as you could well imagine, if it affected their children, it also affected their families and extended families. Last year also, there was an increase in anxiety and depression among young adults, the highest being in the age group 18 to 24. And in this group, we saw difficulty with concentration, avoiding activities, not even wanting to attend online schooling, unexplained headaches, becoming very isolated, very angry. So that between the month January to August, at the height of the coronavirus concerns, there was also an increase in mental illness and suicide. 25% of them 60 years and over, and overall 80% of them being male. So the question is, are we serious, or how serious are we about addressing these challenges, especially among the most vulnerable? Now, then came the lull, the calm before the storm, and everything, you know, God is a Trini, retail stores opened, life resumed a sense of normalcy, vigilance was relaxed, health measures were abandoned by all those who were naysayers. And then it happened again this year, February onwards. The increase in calls to the hotline showed us the parallel increase in fatality statistics, new knowledge about how the virus was spreading. So you could imagine the panic, the fear, the anxiety, the worry leading to prolonged periods of depression and introducing a new variable, brain fog. Now, as Dr. Ratnalakan Singh has very competently explained, very neurologic symptoms associated with brain fog. But what we were finding on the hotline was that people were telling us about poor concentration, memory loss, people who did not have COVID, headaches, confusion, and we associated this with, of course, the fatigue of the entire unknown about this disease and the length of time that many persons had become wary of what was happening. So there were red flags, poor sleep, dietary changes, lack of physical activity, and depression. It is interesting to note, however, that even though calls lessened on the hotline, we had just during this period about 217 calls. When the numbers of fatalities began to surge at alarming rates, other variables of stress were added in addition to what were commonly presented. And this variable were those who had COVID, who were currently experiencing symptoms and whose family members had died from COVID. So if we look at this chart, we would see that the majority of calls came from those who were anxious and fearful and worrying. The second highest number were those with family relationships, and then those who were experiencing death of family members, symptoms of COVID, etc. So at this point, I want to look at the question that we are discussing. Can good mental health therefore end the pandemic? If there is all this concern about what is happening during the pandemic, would vaccinations end the pandemic unless we attend to the mental health issues? And in the 5-step plan, I'm looking at attending to these issues can 1, lessen worry and anxiety in individuals and their families. 2, less worry and anxiety can allow for better reasoned thinking about the virus. Thirdly, reasoned thinking can allow families to understand the scientific evidence and lower their resistance to vaccinations. 4, lower resistance to vaccinations will encourage families to want to access these vaccines. And 5, the more a population is vaccinated, the closer our country comes to ending the pandemic within our borders. And I suggest this 5-step plan, having been on the ground with families, distributing hampers to persons in Laventille, Valencia, Carapo, and getting the opportunity to chat with them about vaccinations, to dispel some of the conspiracy theories that they had, some of the misinformation that they had, to get their views on what was happening with them. So looking at, again, back at the chart here, I just want to look at the 2 main areas of concern coming during this period, February 2021 to present: job losses, increased responsibilities, fear for families, and a sense of powerlessness. What is happening? How can I not handle my family? Frequent conflicts, heightened level of fear, partner and spousal abuse, alcohol as a coping mechanism among the males, and passive and active thoughts of separation and divorce higher during this time. And of course, the number 1 concern, anxiety, fear, worry, and panic attacks. So what do we do? The first thing we must do is to cope with COVID-19, to take breaks from the news if we have to, make time to unwind, set goals and priorities. Whatever you cannot control, leave it alone. 4th, take care of your body, your physical health, connect with friends and loved ones, and focus on the facts of information. Some of the recommendations are in your families to watch out for signs of prolonged sadness among family members, especially children. We had our youngest male, 9 years old last year, dying by suicide, taking his life. Depression, irritability, talks of suicide. Maintain connections with your loved ones. Listen to children and teenagers. Give persons quiet time. Virtually connect and be positive and optimistic, even if you do not feel that way at times. So towards a healthy society, let's look at this. We must attend to the mental health challenges. It is too often neglected by those who have the wherewithal to attend to it for the entire population. We have to allow for persons' rational thinking on issues. They need to understand the facts out there as presented by scientific evidence. We have to encourage families to access the vaccines. And that doesn't mean just from the top down. It has to be within communities, among individuals. The more a population is vaccinated, the closer our own country comes to ending the pandemic within our borders, so that, again, stressing the fact more community efforts are needed, each one to reach one. I thank you for listening to this presentation.
And I thank you most kindly, Dr. Nakid Chatur. Quite naturally, you're making the very salient point that every individual in the country must now become a pro-vax goodwill ambassador in Trinidad and Tobago. Now, I'd like to go to the man in the white room who puts you on the chair and takes you around the world trying to discern what's wrong and how to resolve it. I'm delighted to invite psychiatrist Dr. Varma Dayal Singh for his perspectives.
Yeah, thank you, Gideon, for that introduction. And I am so happy that the other two speakers actually spoke on things I wanted to speak on, so I could just elaborate on these things. Gideon, you mentioned that when COVID-19 took the world, it took us by storm. Because remember, never in my lifetime would I have thought we would have gone through pandemics. Because remember, we had learned in medical school, we had learned about the bubonic plague, Spanish flu, but coming now with this, you know, in these times where you had better health, better, you know, in terms of standards of care, you had persons having the advance of medicine. I never thought this would have happened in my lifetime. So even though this came about, it served as a shock to me. And part of the mental effects of the COVID-19 pandemic, it's really when our life changes, because we are accustomed to a certain way of life, and anything disrupts that, you would have some sort of despair. So let's say somebody dies in our home, even if it's a normal death before the COVID, we would have had that bereavement. If you are now changing jobs to settling, you would have had that settling period, adjustment period. So imagine things like that before would have been there, but now the whole world changed. Our whole outlook changed, our ability to go to work, to go shopping, which is also a therapeutic event when you go in actually shopping. Our whole world changed in terms of interacting with people at work. So when you had that sort of changes, you got persons having mental issues, emotional issues. And it really came about in the sense that initially you had it occurring where you had great anxiety and fear. I looked at it as three things we had: the anxiety and the fear. Then you had, besides the anxiety and fear, you would have had the uncertainty where, and then social stress. So for instance, let's look at anxiety and fear. If I am suddenly in a world where I am fearful of getting infection and even dying, not just for myself, but my relatives, my father, people around me, that would evoke a fear or a change in me. So that fear is carrying me around. Looking at the news would also, you know, when you're hearing all these deaths, that will affect somebody's psyche. Now, there are certain individuals who would take it on. They are the hardened youth who may just say, nothing will happen to us, because the hardened youth will think they are infallible. So you had two sections in society, and remember the Prime Minister had to actually buff some of those young people partying and zesting. So you had those though who had that anxiety and fear, death to self, death to family. Then you had the anxiety or fear of unemployment. Will I lose my job? Will all my savings dry up? All those are things now will be affecting persons. After the anxiety and fear, you would have had things like the uncertainty. Now, what do I mean by uncertainty? Of when this pandemic will end. Because we had cases where persons thought, you know, after a year, we're back to normal. We had, you know, we said we could take this lockdown, but then when it's continued going on, when you find that there are the Delta strains and other strains there, and Delta Plus, we don't know when this will end. So that uncertainty, you know, also brings about that level of despair, mental despair that some persons will have. Then you had also the uncertainty of information. Initially, WHO said you didn't need to wear a mask. Then they said to wear a mask. Then if you get vaccinated, you don't need to wear a mask. Now they come back and say with the Delta, you have to wear a mask. So that uncertainty of information gives us despair because we have no guiding posts, any guiding lines saying this is the way to go. So that uncertainty would have brought about problems at its own. And it's still bringing about because we are still evolving in our knowledge. Then a big factor there now will be the fact that you have the social stress. Now, social stress could occur. You found that suddenly those persons who are under lockdown, you found that you could have gone out. So men who would have been able to go out, lie with the boys, go to work, get out of the house, suddenly they were in a home with their partners. And sometimes, the nerves got each other. So domestic violence increased all over. In fact, in Jamaica, they had some effects where divorce rates increased. So you had that stress occurring there. The domestic violence, divorce, lockdown, isolation has its own effects. So isolation by itself would cause that despair because we are social beings. We like to go, we like to hug. Hugging somebody releases dopamine. So that's, so if you can't hug your boyfriend or your girlfriend, those young persons are now stressed out. Childhood abuse increased. And this is something we always had childhood abuse before. But now with the COVID, children were home and the abusers were right next to the next room. So all these were problems. Burnout. Now, burnout came about where you had the work-life balance was affected. So some people said, I don't have to travel again in traffic to go to work. But look what happened. You stayed home now and you had to now try to teach your children their work, online classes. You know how to, bosses now eroding your time. So sometimes 11 o'clock at night, a bank teller told me her boss would send things first. She had no cutoff period. So you ended up having that burnout now that occurred. Zoom fatigue, where people were on these Zoom meetings all the time. Again, with all of the social stresses, poverty is a major issue because with poverty, people, will have that level of despair. When will it end? What could I do? How could I get out of this? Social services will be important to help that element of the poverty. Then, so when you looked at those factors, you had to also appreciate that you had cases where the whole changes that we had in society took a different pattern where we saw different emotions evolving at different times. So we had what you call a progressive emergence. So many of the psychological problems had important consequences in terms of mental health, included stress, anxiety, depression, frustration, uncertainty during COVID-19. And we saw these emotions emerging. And studies were done by Duan, where they looked at psychological intervention, because they found that, the goalposts kept changing. So we had to now move up with the different fears that were being seen. So it was a progression and it is still progressing now. And this is the thing we are dealing with. So as mental caregivers, while we get accustomed to dealing with certain aspects, other things keep coming on, other events keep coming on. So initially we had all these factors with coming on, and then we noticed we saw depression as mentioned by the previous speaker. So when Margaret mentioned depression, we had adjustment disorders. Once you had to adjust to a new lifestyle, you can get adjustment disorders, being home with depression, anxiety, alcohol, substance abuse mentioned, anxiety disorders, exacerbation of pre-existing mental disorders. So some persons who would have had sitting on that edge to go into depression or anxiety, this COVID now would have, this change and this COVID scenario now would have triggered a disorder. We had panic attacks. So all of these are things we were seeing in the psychological world. And the Oxford University, they looked at the certain things we had. We had pervasive anxiety, uncontrolled fear, disabling loneliness. We had psychiatric conditions manifesting frustration, boredom, and you had different things added to it. For instance, inadequate supplies. So remember at one stage toilet paper run out. So, inadequate supplies, let's say food or food items are now beyond the reach of some people. This will now continue this stress. So let's say there's a shortage in terms of agricultural supplies now, inadequate information, and we seem to be getting information that is, we don't know what to, some people don't know what to believe. Alexithymic traits. This is a trait where people don't know how they are feeling. So they come to a doctor and say, doc, I'm not feeling right, but I cannot describe it. And this is something we were seeing. So all of these things we are seeing, the lifestyle changes and whatnot. But if you notice in the slide, there's something called resilience and social support. If someone has enough social support, they belong to a temple group, they have persons who they can speak to, they have persons in work who will keep in contact with them. Those individuals may not succumb to any sort of problems. If they have that social support, that resilience, some people just have it within themselves, they think positive. So all those are factors that may, keep the mental illness or emotional problems at bay. Then you had instances whereby you had emerging emotions. So this is what we are seeing now. Emerging emotions that we have to deal with, whereby you have the unvaccinated versus the vaccinated. Or what you may be seeing now is a polarization of certain individuals who are vaccinated, and they are sometimes, it comes like if you, initially when COVID came out, you had the persons who were xenophobic against the Chinese nationals. Now you are having people hating certain individuals who are not vaccinated. So this is polarization, is something we have to look out for. We are seeing that level of hatred, blaming persons. We have the anti-vaxxers, human religious rights persons, labor saying that, unions against government and big business. So those are issues we are dealing with now. Those emotions are feeling a sense of control, the government want to control me. Anger, fear, uncertainty is still there. And so those are now emergent emotions that we are seeing among people. Now, Delta strain, which is on our shores now, brings back the flashbacks to the earlier days of the pandemic. So it comes like you have like a sort of a emotional flashback, like a post-traumatic stress. You're not scared. You don't know what is going to happen again. Are we going to another lockdown? So all these are factors we are dealing with. And in this context, when we are looking at will the vaccination help, a mental health issues, we see there's a variety of mental health issues. It can help some, it may not help the others. Will it help brain fog? Well, we went into details of brain fog, depression, and in the pandemic. Well, when we're looking at will it help persons? Now, studies was looked at the general population and the frontline healthcare workers, and they found that the frontline healthcare workers, they are worried, but their worry may be different from a general population. So let us say people are vaccinated, and the general person working in an office, he may not be as fearful. He may not have that anxiety as somebody working as a doctor or a nurse, still dealing with people coming in with COVID. Because remember, the facts show that even though you're vaccinated, you can still get the Delta. So the vaccination doesn't protect you from getting the Delta, but it just gives you it in a milder form. So you'll still have that fear depending on which level of work you are, what exposure you have. You will have the vaccination could give some level of comfort to some, but not to others. Again, there's a difference in the rate of mental ease after vaccination can occur. So it depends on actually the risk of exposure. It depends also not just on the risk of exposure, but if you have new variants on the scene coming about. Then you have the quarantine dangers. Now, studies have shown that even if once you are quarantined, once you're under lockdown, that itself has psychological effect. So it's strange enough, you could just have somebody under lockdown, but you tend to have higher prevalence of psychological symptoms and emotional disturbance, depressive states, mood alteration, long-term behavioral changes like vigilant hand washing, avoidance of crowd, will remain in a certain subset of population, regardless of vaccination or not. So that is a well-known study that was done in the Journal of Medicine, where the quarantine period seems to have important and dysfunctional psychological consequences on individuals, not in the short term, but long term. So all these are factors we are now looking at. How are we going to deal with the quarantine by itself as an independent pusher of this? Now, there's positive COVID diagnosis. 18% of individuals, including people with or without a past history of psychiatric diagnosis, who got a COVID-19 diagnosis was later diagnosed with a mental health disorder, anxiety, mood disorders. So those studies have shown, even though you get vaccine or you're not vaccine, once you have the COVID, you have an increased chance. So you have to look at the world leaders who have gotten vaccinated, who have gotten the COVID vaccine, if there are any changes in their behavior. Remember, so certain leaders worldwide had been diagnosed. So even though you find you're looking at mental illness or mental problems in those individuals, getting a vaccine later on may not help them if this diagnosis is COVID by itself would have given them this initial stimulus. It's a shock to get COVID. Pandemic economic downturn. Again, unemployment is associated with increased depression, anxiety, distress, etc. And studies have shown that adults in households with job loss or lower incomes report higher rates of symptoms of illness than those without job loss or income loss. So we have that, the disparity that we get in. Now, the problem is this. If you get vaccinated and you still have unemployment, it may not help the mental health effect of those persons unemployed. So unemployment has to be tackled separately. Depression, the WHO has predicted by 2030, depression would be the leading disease burden globally. So we know there are a lot of persons who had depression before COVID. With COVID, we found that it now will trigger this one. We have 800,000 people a year would have died for suicide. Suicide is the second highest cause of death in people 15 to 29, the young ones, as Margaret had mentioned. We have to look out for the young ones. So even though depression was there before, we have to appreciate the fact that if the depression is somehow triggered by unemployment, and we don't address the unemployment, getting a vaccine wouldn't help that. Bereavement, if somebody died, one of your relatives died, it may not help it initially. You have to go through that trauma. So even psychological trauma of getting COVID, you found that depression by itself, yes, if the society is freed up and people are allowed to go out, they maybe have that social relief. It may help depression, but on the whole, there are other factors that plays in the depression. You remember brain fog? We had mentioned brain fog, cognitive impairment as well. The speakers already went through that already, and I'm not going into the brain fog again. But what we have to appreciate with brain fog, though, is that we have to appreciate with the brain fog, you have the effects of memory loss occurring. And people were wondering what it is we were seeing here, how we were seeing this sort of scenario where people after would just be tired, where they would have the, they're not thinking properly. But there are certain, as I'm saying, theories, and our neurologist might elaborate on that, but there's also clinical trials currently looking at a pressure drug, losartan and steroids to help that, and something called constraint-induced therapy to help those things, the brain fog. Now, children and adolescents, I think that once a vaccination helps free up society, you find that children and adolescents may be a subset of persons who may really improve, because the children and the adolescents, we have seen the prevalence of depression and anxiety symptoms during COVID has doubled compared with the pre-pandemic estimates. And it was higher when collected, and especially in the older adolescent girls. So we definitely have seen the girls more affected. We have seen youth around the world has had the disruption in their everyday. So let us say you are not having you can't have your birthday party, or you cannot have certain things that you would have wanted to do at certain ages, you would find that they would miss out. So therefore, let's say you have milestones not met. You have the quarantine, increased family stress. All those factors, decreased interaction, would cause socializing, would cause children and adolescents to suffer. But I think the vaccine, if it allows children to go to school with the Pfizer, if it allows the opening up of things, this is one way where the vaccine may be able to help that. What's the benefits of the vaccine? The psychological impact of the COVID-19 vaccines, right? A study was done by Jim Kim, where they found there's the effects of it gives us antibodies. So that's something positive we could say. It gives us a chance to recover from the emotional stress of a burden of ongoing pressure and stress of the vaccine, of the virus. It gives us some degree of freedom and control again in the world. We can go out again and a chance to move forward. So there are definite benefits. We have to be appreciative that the CDC mentioned that the Delta variants are less likely to have severe cases or die if you have been vaccinated previously. So this is the importance of vaccine. Even though the Delta is here, you may be more equipped to survive. And to be honest, our health services cannot take a glut of persons coming in to our ICUs. We cannot take it. So we have all to do in our possible limitations to try and get people vaccinated. Fully vaccinated people can still transmit the virus. The main concern, I say, is the onslaught in our health system, and it can help against the severity of the infection. And in conclusion, I say we need a choice of vaccines. We need to, because if you realize when you had the AZT available, people just went on mass, and the minister was probably surprised to see people going, and it had a congestion again. So we need people to have correct choices. We need to get the approved vaccines for pregnant women and teenagers. But again, the enemy has become really misinformation and really denial. Thank you, Gideon.
And thank you very much, Dr. Varma Diyal Singh. It must be very satisfying to you that you were not interrupted by the chair in any form.
Yes.
And we allowed you to make your presentation uninterrupted, which was part of the specifics given me by the lady of the moment, whom we shall introduce next. Our final panelist in this segment of the program, geneticist, Dr. Nicole Ramlachan of the UTT. Good evening.
Good evening. Thanks so much for all the panelists for joining us on our efforts to educate on COVID-19 vaccination. I'm just going to share my screen here quickly and we will get started. I'm on the tail end because, we have to go in order of brilliance. No, I'm just kidding. No, I'm on the tail end just because we are trying to end with the main message which we're trying to give here today, which is vaccination helps in terms of all of these different issues we're dealing with. Last week, we dealt with a lot of the clinical issues in terms of physical illness caused by COVID-19 and how the vaccinations assist with that. And today, this week, we're dealing with the neurological as well as the mental health issues and how COVID-19 vaccinations can help with that as well. So I would just like to go straight into this. And I always put the slide up at the beginning. And the reason why I do that is because we have to emphasize to everyone that this pandemic is not new to humanity, right? Everybody knows about bubonic plague and Spanish flu and a couple of the others that are destined. Of course, since then, Asian flu, bird flu, all the flus, swine flu, which were all viruses previously found in animals that were able to mutate because of things like wildlife trafficking, habitat destruction, climate change, all those things bringing animals closer to the humans to be able to be exposed to them. And of course, their antigens enter into the human bodies to be able to say, okay, well, is this a new host? Of course, they're not saying that, but that's really what happens. Viruses just want to replicate. So they're always going to look for new hosts to replicate. And through the ability of those viruses to mutate, and coronaviruses are viruses that are notorious for mutation. That's why we have the bird flu, the swine flu, the Asian flu, Spanish flu, all of those different flus, because flu in particular is one of the most antigenic viruses. However, we also do have a lot of coronaviruses, of which SARS-CoV-2 is a family member too, including the original SARS that created a pandemic in the early 2000s, and as well as MERS, which also created issues in 3 or 4 countries around Saudi Arabia later on in the mid 2000s. So we have a lot of experience with this ability of viruses to mutate and change and reinfect. And that's what we're seeing with the different variants. People are getting very frustrated with the variants. And I mean, they have to understand that that's what viruses do. Viruses mutate in order to be able to exist. Some mutations may not last and they may die off, but some mutations, unfortunately, for their new hosts, in this case, humans, will allow them to actually change and be able to be more susceptible, allow the host to be more susceptible, i.e. the virus becomes more transmissible. And also, unfortunately for us, it seems that the Delta and the Gamma are also more transmissible in youth and children, where the original variants were not, because they were able to actually adapt using the spike protein on the surface of the cell, which is sticking out here, you all could see in the slide, that actually changes now to hooks onto our ACE2 receptors and our lung cells and causes big, big problems for us, right? So the symptoms run the gamut. So again, there are lots of different pandemics that have occurred in the history of humanity, and probably a lot more to come, unfortunately, because while we have this constant mutation of these viruses and we have this encroachment in the environment, these wet markets, the ability for those viruses to be exposed to new hosts, we're going to see the cycling for years and years to come. However, this particular pandemic we are dealing with right now, we were really not prepared for an outbreak at the time, even though a lot of experts were saying, yeah, we do for one, usually every 100 years, but I mean, some in between that are really bad, but the 100-year ones are the ones that are usually, really worldwide pandemics, which is what we're seeing now. In case of Trinidad, we had about 40,574 cases so far, 1,144 deaths. In case of the world, we have 4.32 million deaths. So it's not decreasing at this point in time. Worldwide, we're seeing increasing numbers of cases. And the symptoms that we kind of see run a gamut of neurological issues, ARDS, respiratory issues. Eventually, if it gets worse enough, organ failure. Of course, they could be intubated and on a ventilator. If they do recover, a lot of them, if they have mild symptoms, or even if they end up in the ICU and they recover, they will have long-term COVID-19. And there's a lot of these symptoms that are listed here people have, and usually between 5 to 20% of patients have these type of long-term symptoms, of which forgetfulness, depression, brain fog is a large part of it. How long is long COVID? A lot of people ask this question. Well, we only know up to the statistics we have, right? And they know that once you persist more than 4 weeks, you're considered to be in a long COVID stage. And we know that people have actually had it up until now 9 months. So because that's how much data we have, right? This particular Nature paper ended at about 18 weeks and people were still showing symptoms up to 18 weeks. And we know now, even 9 months later, people are showing long COVID symptoms, including brain fog and neurological deficits. In this study, the biggest study so far, where everyone can look at the data, and I encourage you to do so because this is real data, measurable, was by a group from England called the REACT group. That's one of the biggest studies that they have, and they showed over 500,000 adults in England checked 1 in 20 had persistent COVID-19 symptoms, which is a lot, right? One of the symptoms, as I mentioned, is the brain fog. And a lot of the therapies that go into it are things like tracking symptoms, journaling, asking for help, maybe drugs, maybe cognitive therapies. Some of the specialists who spoke today talked about that. And one of the things that we need to recognize too is that a lot of these studies are actually showing now that COVID-19 vaccination can actually help reduce long COVID symptoms, including the brain fog. Right. In addition, of course, providing a lot of physical, psychological and psychiatric support for some of these individuals who are having these things. There was one study that I thought was really interesting that came out of Southern California, where they are saying that there are different patterns to their brain, to people's brain functions, right? And they published this in Brain Behavior and Immunity back in 2020, I believe, early 2020, and it's called The Impact of COVID-19 on Mental Health, the Interactive Rules of Brain Biotypes and Human Connection. And I thought this was really important to bring to you for you all to look at and review, because a lot of people realize that the COVID-19 crisis has significantly threatened our basic human need for human connection. And actually, they don't really realize that that is a very crucial environmental factor that could underlie the overall insult to our mental health. And a lot of that is based on the different biotypes. And this is some of them here. And some of them might be recognized by people looking at today. You may not be clinically depressed or have anxiety disorder or be diagnosed with one of those, but you can actually quantify using some of this work from this group the way that your brain circuits can be disrupted. And you could be one of these. You could be a ruminator, an anhedonia person with negative bias, people who are affected by inattention, threat responses, or even a cognitive fog, where they actually have the brain actually feeling foggy, which happens a lot more in a long haul COVID effects. Now, since we introduced the concept of vaccination, helping with this, what's been happening so far with vaccination worldwide? Well, at least one dose has been given to 2,373,026,128 people, which represents the 30.4% of the worldwide population, but 15% of them have been fully vaccinated. That's about 1 billion. So we're still very low down in the totem pole in what we want to go for, because technically herd immunity, if you would have seen the previous presentations we did, of which we've done about 12 now, herd immunity is one of the big ways we end this pandemic. And the way we get to herd immunity is not through 15.8% fully immunized population. It's more like 70%, 75%. So we have a long way to go. However, this 4.54 billion doses given to date has given us a lot of information that we use to be able to track a lot of these vaccines, to be able to understand them. So let me introduce the vaccines to you. The mRNA vaccines are like the Pfizer, BioNTech, and the Moderna, where they actually take the spike protein that I talked about earlier that sticks out on the surface of the virus. They take a short little sequence of that in the mRNA form, package it into lipid fat nanoparticles that can actually dissolve upon entry in a vaccine. And the host cell goes through the machinery of producing the proteins. Now, I want to make a very, very specific point here, which I always make every single week on every single lecture and every single time I speak. mRNA cannot mix with your DNA. It can't happen at all. Secondly, the mRNA vaccine goes to the mRNA from the vaccine goes to the ribosomes, which is outside of the nucleus. So it's not even physically able to mix with your DNA. So let's just, refute that myth right now. And what happens is when the mRNA codes for that little sequence of spike protein, the body produces that protein from the ribosomes, spits it out, and the antibodies and the T cells and the B cells start to respond to that. And that's how you get your immune response and your long-term immune response from your second booster. Because your second booster is like if you've gone to university after your first booster being kindergarten, right? So now you have a long-term memory and every time you see that, you're gonna react. What's bad about this is that the fat molecule is very, very biodegradable. So you need to actually keep that at -80, -70, which has problems for transfer to countries who have supply cold chain issues like Africa and so on. Even in the Caribbean, sometimes it's problematic to keep those things at those low temperatures. The adenoviral vector vaccines like the Oxford AstraZeneca and the Johnson & Johnson are replicating viral vector. So they're a little bit different. The same mRNA spike protein is coded, but this time they put it into a viral vector. And that viral vector gives an additional boost. So not only the spike protein being created and made in the factories of the ribosomes of the outside of the nucleus, which does not again touch the DNA, but also the adenoviral vector itself gets created. And that gives the body a little irritant that says, you know what, let me react to this, let me build some antibodies to this does not look good. So you get that double whammy effect and you get a strong immune response. So that's the technology behind this. This is about 15 to 20 years old. It was used last in the Ebola outbreak in 2014, 2016 in Africa, and they were actually able to immunize over 400,000 people with the adenoviral vector vaccine mRNA model that they use. So this is not a brand new technology at all. It has been adapted, and that's the great thing about the mRNA style of vaccines is that they can tweak that into the carrier and put it into arms very, very quickly. What was the problem before is that we didn't have that fat molecule idea or that adenoviral vector idea until later on. So that's what allowed these vaccines to be produced so quickly. Sinopharm Beeper, which is an inactivated old school vaccine, 200-year-old technology. All they do is take the virus, kill it, stick it into a vaccine with an adjuvant that's going to irritate your body again. You get injected, and guess what happens? Antibodies get produced to the entire viral molecule, so the whole virus, right? Very old school, 200 years old from the smallpox days, right? And this is what we use to eradicate smallpox. This is what is used for polio. This is what's used for MMRs, all your childhood vaccinations that you give your children. Everybody lines up in the pediatrician's office to do this. Exactly the same technology is used. Inactivated whole vaccine, right? That's been killed and inactivated because of a chemical application, and it allows your body to react to that. So for people who don't like the newer technologies, the Sinopharm is a really good option. If you have it available, we have it available in Trinidad. And I always tell people, if you don't feel comfortable taking the newer technologies, take the Sinopharm because it's old school. This is what we all give every single body who has a vaccine of any kind right now is almost always inactivated vaccines, right? Have there been serious adverse effects? These have been detailed in great effort by myself and some of my peers. And we have all of this in the YouTube videos and UTT's YouTube site, as well as different ways. But the end result is that there are going to be serious adverse effects and risks with every single thing you put into your body. Down to water can kill you if you take too much, right? So that's the first thing I would like to establish. In particular, the Johnson & Johnson and the AstraZeneca had issues with the blood clotting and the vessel leaks. The Pfizer had issues with the blood clotting and the myocarditis. Moderna had issues with the blood clotting. And Sinovac had issues with encephalitis. And of course, all vaccines can cause Guillain-Barré, right? So that's something that's standard to every single vaccine. One of my cousins actually got Guillain-Barré when we were younger from vaccination. So adverse serious effects occur. However, on average, they occur at a maximum of about 1 in a million in terms of chance. So therefore, everybody pretty much, any expert you speak to will tell you, any immunologist, any immunogeneticist, anybody like us in this panel will tell you that the benefits outweigh the risk because it is so rare. So for example, out of the 12.5 million Americans who got the Johnson & Johnson, 100 people reported GBS, which was Guillain-Barré. None of them, 95 of them were serious, required hospitalization, and 1 died, right? So that's 1 death in 12.5 million. So that has to be considered versus the reality with COVID-19 infection, where it's a much higher risk of dying. What's been happening with Delta, which is a new mutation, is that it's been increasing a lot of cases around the world. So this is United Kingdom, Spain, Portugal, Netherlands, Greece. This is July 9th, and literally all of these countries had exponential increases in the daily new confirmed COVID-19 cases per million people, right? What was different though is the deaths. They didn't see the types of deaths that they saw last year or earlier this year because they had a lot more vaccinated people, right? They just announced today that Delta has 2 confirmed cases of Trinidad has 2 confirmed cases of the COVID-19 Delta variant, which were found in returning nationals, 1 from the US and 1 from Guyana. And what that means is that we have now confirmed that a lot of the transmission that we're seeing in the community may be due to Delta, right? So that is scary because the transmissibility I talk about, the ability of that virus to be able to infect the lung cells and the ability of that virus to be able to infect younger people who have no comorbidities is much higher. The contagiousness of the virus also is much higher. It's like 1 in 8, 1 in 9 versus 1 in 2. It is almost 90% more contagious than the original virus and about, I think, 50 or 60% more contagious than the beta virus, which was the most popular one most recently in the world. What is good news? That is the bad news, right? Because it's always a bad news, good news story. The good news story is that the vaccines that we have in our arsenal against this joint enemy are very effective against the variants, right? There was some news that came out of England about the Pfizer and the AstraZeneca being quite effective against the Delta. There's also some words coming from India that it seems to be effective against the Delta Plus. There is word about the Novavax and some of the other vaccines that haven't been released yet in their trials because they're being released while we have these variants in circulation, and they're showing good effects against the South African variants and some of the others. Sri Lanka actually published a study 2 weeks ago that found that the Sinopharm COVID-19 in particular was very highly efficient against Delta, as well as in Brazil, they found that it was efficient against the Gamma. So we have good news. The vaccines that we have, i.e. the weapons we have, work against these enemies, including the mutations, including the ones that are different, right? So you have to imagine like you're fighting a war. Somebody might come up with a bigger tank than you, but then you could come back up with a bigger tank than them. And that's how it works, right? So that's pretty much what's happening with this. We can still fight it and we can still prevent death and hospitalization, which is what we want, and severe disease. How have we been doing against the rest of the world? We are at about 13% partly vaccinated, 17% fully, a total of 30% with at least 1 vaccine. Cayman Islands, which is much smaller than us, have done really well at 77%, almost 75%. Seychelles is right at about 70% fully vaccinated. Canada is about 60-something%. United Kingdom as well, 60-something%. Germany, Maldives, which again is a small island state, it's been done very well because the numbers have been high in terms of people that have been able to have access to. The United States also right at about 50%. So if we look at this, and Guyana in our region at about 34%, Barbados about 35%, Colombia about 39%. So we're doing okay. However, a lot of these countries that are suffering right now from big breakouts and high numbers of deaths, like Indonesia, Thailand, are not so good on the scale of fully vaccinated, right? We're seeing greater numbers in Bangladesh as well as some of the African countries spiking in terms of deaths now. And it's because this is really a pandemic of the unvaccinated now. In terms of the fully vaccinated people, I just wanted to convert that into numbers. We're at 240,540 people fully vaccinated, which translates to about 17.3%. So the darker the green, the more vaccinated. So we're getting there. We're somewhere in the middle part, but we need to ramp this up. So we have to come with what motivates vaccination. So this is a particular study, the Kaiser Family Foundation, and a lot of the motivation was from things like people were saying, well, I am a wait and see. If it gets full FDA approval, I probably will take it. If I get advice from my doctor, I'll probably take it 46%. If I'm required for it to fly, 41%. If somebody tells me to go to a game or concert or something I really want to go to, a football game or something, I have to get it 40%. Interestingly, when it comes to the money, 14% said they would take it just for $100 in cash. That's it, just $100 in cash, they would take it. Sometimes people don't realize free transportation is a big deal. For some of these people don't have the money to actually even come to these locations. 12% of people said that they would take it. This is all in the US, by the way. Some people, look at this down here, 9%, almost 10% said if you give them a $20 food coupon, they will take the vaccine. So that is what we have to think of, the mental pull for why people would take vaccines and provide these incentives. They've been doing that in the rest of the world, and we really have to get on board that in our region and in Trinidad. People have been running lotteries. This has been actually used in Africa and Latin America quite a bit for use of health services, including pediatrician visits, nutrition consultations, educational sessions. And in one study in Nigeria, they found that conditional cash transfers actually increased childhood measles vaccination rates by about 27%. And we've actually seen that, for example, in the University of Pennsylvania, set up a vaccination lottery for a grand prize of $50,000, and they actually got quite a good bit of buy-in. So there's a lot of ways that you can incentivize this to be able to get people to get into the vaccination protocol and into the program. If we look at willingness to get vaccinated as well too, this is a study that came out of the Imperial College of London. And what is interesting is I want you to look at the reds. The reds are unvaccinated and not willing to get vaccinated. That is if they don't care how many vaccines you have, they're not sure, nobody could convince them, they're just flat out saying no. And you would notice countries like Japan, South Korea, Spain have about 40%. And getting into the Europe, we get Norway, Italy, Sweden at about 23%. And the highest number seems to be in France in that area, 30%. I didn't include any in our region because this particular study didn't look at that. But we'll have to assume, say 30% is about the maximum number of people who are saying they're unwilling to be vaccinated regardless of what. And these are the people that might have to suffer the consequences of mandatory vaccinations if they want to go to a particular school, if they want to work for a particular employer, those kinds of things. But that will come later on. We actually have a panel discussion on mandatory vaccinations on the 25th of August on Wednesday that week, and you all could join us there for that. But this is an interesting concept, right? So that regardless of, sometimes, depending on the country, somewhere between 15% or 14% and 30% of them are going to say no, right? Regardless of what you try to say. Now, sometimes people think it might be simple, and Dr. Dialsing mentioned this. Sometimes this could be as simple as a choice of a vaccine as a motivator, right? We have Sinopharm, Oxford, AstraZeneca, a little bit of Pfizer. We're getting more. We just heard today 350,000 might come. We're supposed to be getting more. Johnson & Johnson, not sure when it's coming or if it's coming. But basically, if we look at pre-survey results that we did at the UTT here, just from Trinidad and Tobago, it shows that some people just want a choice of vaccine, and that might be enough to get buy-in from them. The inability to choose actually sometimes exacerbates the mental disorders. We talked about a lot of the other speakers spoke about anxiety, depression, because they feel they're being backed into a corner. They don't feel comfortable with being given one option. For some reason, for travel, they want one over the other, because a lot of countries now are specifying what vaccines need to be taken to preclude quarantine. It does not ban you from the country. I need to add that, because a lot of people are saying that if they take Sinopharm, they're banned from going to Canada. No, you're not banned. Canada accepts unvaccinated foreigners as well, or will, once they're not in lockdown, if you quarantine, right? So these are the things that concern people. And I mean, once we have choice, I think we're going to be able to handle a lot of the naysayers and be able to get there. Now, I want to add about these specifically in terms of the psychiatrists and psychologists being valuable vaccine educators, because there's a really important role to be played here, right? When you're watching the news or reading articles, a lot of the physicians that contribute are the clinicians in terms of internal medicine, epidemiology, emergency medicine, and so on. But really, psychiatrists can really be valuable in this role as well. And I would like to add that and encourage anyone to be able to visit psychiatrists if they can, if they have these issues with mental health. I put this little anecdote here about the psychiatrist in Mississippi, and he was talking about they have the lowest vaccination rates in Mississippi, and they have a really high Delta transmission right now. And he's saying part of his practice is that he actually reserves time at the end of every appointment where patients can actually speak and discuss this with them. So adding empathy and engagement is very important. It may be very difficult, and I speak to everyone here, not just professional psychiatrists, speaking to people who have adverse almost guttural instincts to say no as soon as you start speaking about the vaccine, which, I've been doing for a few months now. Really, if you engage them, sometimes they just want a conversation. And one of the easiest ways to keep that trust and encourage them to get the vaccine is to tell them about your own vaccine experience. And I always start with that because I had 0 effects when I took my vaccine, me and my entire family actually. And we were able to actually recover within 24 hours from anything we may have had, which may have been as mild as a headache. In the case of my brother, I believe he had a fever. So that actually is very important. The truthfulness is really what's important in this, and the ability to be able to communicate effectively. This particular MD was talking about how cruelty won't end this COVID Groundhog Day. And it's funny, I found this article because I always refer to what we do as a Groundhog Day because we seem to be doing the same thing over and over without any difference. And what they're saying is don't be cruel to people who don't understand, because sometimes people just don't realize what they do to themselves. And the quote that he puts is that the trauma ICU is filled by man's cruelty to man, but the medical intensive care unit is by man's cruelty to himself. And in this case, COVID-19 kind of enters into there, and especially lack of vaccines. We've been seeing all these stories online where people are dying from COVID-19 and telling their caretakers, man, I wish I took it, but can I take it now? And the doctors have to tell them it's too late. No, sir, you cannot take it now. You should have taken it 6 weeks ago. And I'm sorry, I can't help you. You have to just, hope that you recover. So that's something to think about. And social media is a really big place where we're seeing a lot of misinformation. And I encourage everyone who has a role, who has a Facebook account, who has an Instagram, to try to get the word out there and let it be an ongoing dialogue where not just when it's a pandemic, right? We have to be active when we are constantly searching for solutions for vulnerable populations. What is good news as well too is the vaccinations can actually ease symptoms of long COVID. A lot of the studies that were showing that it actually relieves fatigue, brain fog, muscle pain, shortness of breath, loss of taste and smell. And they're thinking it's because maybe it cleans up some of the residual virus and allows your body to restore a healthy, balanced immune system. So that's why it works so well. We don't know how long it lasts because, sometimes some of these people have been vaccinated for a few months, and so far it seems to be lasting. This particular Akiko Iwasaki said that she's had anecdotal responses where people no longer have the brain fog or have GI problems or anything like that, shortness of breath that they've been living with since being diagnosed with COVID post-vaccination. So this is very important information to get there. As many as 30 to 40% of people who've gotten the vaccine have reported improvements to their symptoms. These are people who've been previously infected with COVID-19, still actually having a great benefit from being vaccinated. And of course, this vaccination now allows them to have long-term immunity versus short-term immunity and immunity to basically all the variants that we have in circulation right now. So this is very important to consider. There's also the mental health benefits of vaccines. We're helping the world get back to normal, right? So as the vast majority of people get vaccinated, there's always going to be a minority, as I talked about, somewhere between 14 to 30% that won't or can't. Of course, the ones who can't will be a little bit higher because there will be people who be immunocompromised or the age. 100% of children under 12 in the world are not vaccinated. Those individuals cannot be vaccinated yet. However, the feelings and opinions around the vaccines are very emotive. And even if you force people in the workplace, it's going to be complicated because then you have to work with those people afterwards that you just forced. So there's a lot of information where it shows that while vaccines are designed to prevent physical disease, getting vaccinated is very, very powerful to take back control of this pandemic that disrupts our everyday life, being able to prevent the COVID-19 infection to a certain degree, transmission to a certain degree, but most of all, almost 100% of people will not get severe disease and die if they're vaccinated. And that is really what we want. If you get infected with a natural COVID-19 and that spike protein gets into your body, it can invade your brain, cause inflammation, potentially serious physical and mental effect that is long-term. And many, many months after. If you're vaccinated, it's going to give you a massive mental health boost by dramatically decreasing your risk, right? What is your risk if you don't get vaccinated? You can infect others, right? You can expose people, cause death and disease in the immunocompromised, elderly, and children with no immunity. As I mentioned, 100% of children have no immunity, right? That's a lot of stress for a lot of kids, They don't even want to go back to school because they're scared. They're living with this mental stress of, I can't touch this, I can't hug up Timmy, I can't go sit by my favorite friend. First of all, they're not even going to school, but if they meet each other in communities, you can see the stress where they have to check themselves. I have a daughter and I see it all the time. So you are serving as a pool. If you have children at home and you are unvaccinated, you could bring it home. You could bring home COVID-19. It circulates in unvaccinated people. I can't stress that enough. People always tell me, what's the point of getting the vaccine because I could get COVID-19? Yes, you can get for COVID-19. There's a breakthrough rate of about 2,400 and 500 million. Yes, you can get it. However, it's not going to replicate in your body at the rate of an unvaccinated person. It's not going to mutate in your body if you're vaccinated at the rate of an unvaccinated person. You are no longer going to be an incubator. And if you can get vaccinated, you can reduce this risk, right? That's really what the rule is. Most COVID infections are not occurring in vaccinated people. I just want to say that this is what's happening here. 50% of the infections among the vaccinated was shown in this particular model, and it's more important to look at where the infection rates among the separate groups. So there's a 13% infection rate in the unvaccinated, and there's a much smaller infection rate in the vaccinated of 2%. So that would indicate that vaccines are working and COVID infections are not really very high amongst the vaccinated. Right? COVID vaccination also doubles the protection for the previous infected. They will not get reinfected if they've had long COVID, if they've had all that stuff. In this particular study, it showed that. Also, it prevents deaths, frankly, and that's really the truth. The COVID vaccine program deputy chief in England said around 60,000 deaths were prevented from their calculations. In the US, they're actually expecting Delta to not really be as deadly as they would have seen in the previous variants because more people are vaccinated. So the spike in the deaths, I mean, it might see an increase in cases, but the spikes in the deaths are not going to be what they would have seen before this time last year with the previous infections. Misinformation is frankly killing people. Down to President Biden has said that he's asked platforms like Facebook to be more controlling of the falsehoods about vaccines in the pandemic because it's becoming critical to let people understand that they have to be vaccinated. 99% of the deaths are in the unvaccinated. That is the reality. There's no way to hide that. If you look at any data set in any country, that's what they're seeing. Right? At least more than 95% or more, somewhere between 95 and 99%, or 99.9% in some countries are unvaccinated. And by spreading misinformation, you are preventing people from getting vaccinated and therefore allowing them to actually be susceptible to the virus, get infected, and possibly have severe disease and die. Do COVID vaccines 19 work? I always end my presentation with this. This is what happened in 20th of January 2021, 3,334 deaths per day in the US. It went down to 370 when the vaccinations went up to about 140 million people fully vaccinated on June 7th. So it does work. There is a 100% inverse correlation. If we block out this susceptible host and we achieve herd immunity, we're going to completely kill this chain of infection. The virus goes away, just like what we did for smallpox, just like what we almost did for polio. It eradicates it. We can eliminate it like what we've done for childhood diseases by doing this. There's no confusion here. And the role for ending this pandemic is extremely clear. We can improve mental health. We can reduce these neurological disorders that we're seeing in these individuals if we just get vaccinated. So again, I encourage you, get vaccinated. And now I guess we go to questions. Thank you.
Thank you very much, Dr. Ramlachan. You know, there's always a healthy element to humor in the midst of serious issues. I was about to say that your speaking time is about to expire, but you stopped it just before I said so. And I know, as you said, you've been speaking about this for months, and I'm sure that you can go on talking about these issues for months and months ahead. Thank you very much. I don't know how much time we have left for questions, unfortunately, because it's now 7:28, and my understanding is that we are supposed to be ending at 7:30, but I'm getting the go-ahead from Mr. Ghansham Mohammed to entertain a few questions. I don't know if we have any from the public, but we're asking the public to ask your questions on the YouTube chat feature so that we can share. the information. Dexter Daniel, good evening. You mentioned risk of GB syndrome. Is the role of GB, and it came out just before. It's a question to Dr. Ramlakhan Singh. So Ghanshyam, can you please return with the question so that I can complete the actual question? Is the rate of GB occurrence seen? This is a question to Dr. Ramlakhan Singh.
Yes, hi, good night. Well, what I can say is that we are not seeing more Guillain-Barré syndrome. So Guillain-Barré syndrome is a rare neurological complication of COVID. And we have had Guillain-Barré, but it was either, the cause was either undiagnosed or was not identified, or it's because of another type of infection, but not identified in COVID patients as yet. But you know, if allowed to persist, it will happen, but not more prevalent than normal for the time being.
And this is a question for anyone. Due to the pandemic, mental health took a toll on most people. Now, what's next? How prevalent is it in Trinidad and Tobago as a result of COVID-19? Anyone on the panel?
I think the person is asking the question, can they take the vaccine while on antidepressants? And Varma may want to answer that. So, yeah.
Yes, there's no sort of contraindication for antidepressants. But what we found though is that persons who had a mental illness before, like depression or schizophrenia, they may be hesitant to get the vaccine. The depressed individual is just there, no sort of what I'm saying, no sort of volition to say, let me get out and go and get the vaccine.
Yeah.
Or even persons who are schizophrenic or delusional, they may now go into a phase where they don't believe this or they don't think about the conspiracy theory. So it is a little more difficult. So I think we as mental care givers have to nudge those individuals to say, hey, you have a greater risk of dying with mental illness because schizophrenia and all these individuals, schizophrenics could, you know, have their mortality, you know, is higher. So we now have to get that message through. You are the population we need to get. So I think it's convincing in our clinics really to get those individuals to say it's safe, but we need you to get it. So just as how you have the at-risk population where the old age homes we wanted to tackle, we now have to tackle our mental health clinics also.
Dr. Dayal Singh, in cases of financial stress, and before I go to my question, this is one for Dr. Ramlakhan. Comes on the screen and goes off as quickly as it comes on.
I can read it. I can read it for you. It
Please,
says,
please.
what are the potential long-term effects of vaccines? We've done over, as I mentioned, 11 sessions on different aspects of vaccination, including efficacy, including safety. And the WHO vaccines, of which we have in Trinidad and Tobago, are actually showing excellent safety records, according to the WHO state scientists, who are much smarter than I. And I will tell you that I've reviewed a lot of the data, and there doesn't seem to be any issues that have come up in any of the clinical trials. And I did want to emphasize that we've given over 4.5, almost 4.4 billion vaccines. And if it is that there were potential long-term effects that were serious and adverse, they would have come up by now, right? Because that's more vaccines that we've had in arms for the entire history of humanity. This has never ever happened before. So it's like we have a live clinical trial going on basically for every single vaccine, including the WHO vaccines, which we have here. And so far, no, most, the deaths are coming from the unvaccinated who've had COVID-19 infection, and not from individuals. And the serious adverse effects that we're seeing is from COVID infection. Very rarely are we seeing any from vaccination.
I know that Dr. Dayal Singh did make reference to choices, saying that there should be choices. But isn't that part of the confusion that people are dealing with at the present time?
Is that to me?
To anyone.
Okay, well, I just, my 2 cents is that the choices are there just because of the existence of having different manufacturers. Now, whether or not somebody should be forced to take a particular vaccine is a different conversation. And I think what Dr. Dayal was mentioning, which is what I also mentioned in my studies, that a lot of the surveys that I've done that have actually shown vaccine hesitancy comes from not having a choice. Because people want to have a certain amount of control of what they put in their body. And if they feel mentally that they're being pushed to take a particular brand and only that brand, then they become a little more adverse to it. So choice can help in terms of vaccination strategies.
And some people do their own research. So they may research something and figure, well, might be a better option than this. So I've seen some people actually holding out for the Pfizer. So if we are thinking about vaccinating our population, I think the greater choice we have and allow the population to get what they have, we will now achieve that. So that's one way where people hold out because of their choice. And I think sometimes the information that is coming, changing information, is where we play an important part in telling persons, hey, there's no microchip or there's this conspiracy theory. So the information that they gather from professionals would be another way where people could make up their mind. But there's a small section of persons there. There's a condition called trypanophobia. It's about 25% of adults, they're scared of vaccines or blood or anything like that. It's a somatic symptom. About 7% of those persons don't want vaccinated.
But you know what will help with that, Dr. Dayal Singh, is some of the options that are coming up in late 2021 and 2022 are oral vaccines.
Yes.
So like oral polio. So that's been kind of encouraging people, because you're right. Some people have that needle in their arm phobia, regardless of what you offer, and they're not going to do it.
Yeah, so that is and then I give some people a little Xanax to take before, let somebody hold their hands, let them see. And so you have ways we could try and, mitigate also.
All right. You talked in a presentation elsewhere about the effects of financial stress. And we've witnessed a lot of this in Trinidad and Tobago previously. I remember when I was in another place, every day almost there was a murder-suicide in Trinidad and Tobago. Abusive relationships, you contend, will get more abusive in these circumstances, Dr. Dayal Singh. What do we tell people who are so challenged?
Well, the thing is, if people even getting more vaccinations, you find that if you're unemployed and you cannot afford food, or some men say they are emasculated, they don't know how to provide food for their children. So that mental toll actually affects people. And some studies was done, and they showed that adults with job loss or lower incomes report higher rates of symptoms of mental illness than those with, come 53% to 32%. So we know that is a factor. But even before COVID, we know we were in economic hard times. So that economic hard times that we had, where people were losing their jobs before COVID, was taking its toll on people. We found men were getting depressed, men were drinking more, beating their wives more. And that was an effect that was there before. COVID has made it worse. And I don't think vaccination will help that unless it could somehow open the market. But you see, the job loss or the lack of opportunities for persons to work is something that will remain globally. And so those individuals, we have somehow to reach out to them. Ministry of Labor, we may have to get individuals and retrain them, get them in some sort of group talk where we can even help them home with what you call grow box agriculture, something to engage those persons who actually have lost their jobs. We have to get those individuals, because they will be there after COVID has gone. Because remember, this COVID crisis, they say the mental health effects is like a pandemic within a pandemic, you know. So after COVID has ended and we have vaccinated all those people, the mental effects will be there for years. So we have to pick up the pieces, and is it Ministry of Social Services have to come on board also, reach out for those individuals, see how we could get them, how we could retrain them, get them into that group where they feel, you know, they are persons just like me and we could bounce ideas through.
Dr. Nakid Chatur mentioned the helpline and the number of people who have been calling. I was told only last week of a case where a senior citizen from central Trinidad ended his life prematurely because his daughter in the United States died, and he could not have seen that body, given closure, you know, perform the final rites. All of these issues. Are we looking into these matters, Dr. Dayal Singh, or any member of the panel?
One of the things that a lot of people, Gideon, don't realize is that COVID-19 has facilitated what is known as complicated grief. Complicated grief is a grief that leads to depression, leads to mental illness, and as that older person took his life. Now, complicated grief usually happens when there is no closure to an issue, when a person cannot understand. So you described he couldn't see the daughter, he couldn't go up. Nobody wants, no parent wants a child to die before them. We don't have that expectation in our society. And what we are seeing, even in this society, a lot of callers are calling in to tell us that they couldn't even visit the funeral of their husband or their child. This nurse called in to say her mother died and her brother died in the space of a week. She was in quarantine. So as Varma just said, we are going to be dealing with the long-term mental effects in this society for years to come, for complicated grief that is not attended to in any significant way. Imagine we have a society where people are dying and you're not allowed to see your loved one, you're not allowed, we don't even have a funeral anymore. We don't have a wake where we mourn as a community. And I can see the ripple effects and the after effects of this for years to come.
So it brings me perhaps to the final question for this evening. And if I didn't ask it, I know that I will have to be looking for mental sort of relief. And that is, there is a case that is going before the courts with respect to burials and cremations and things like that. Is that a good idea, or is it not?
What do you mean, that they should have?
It comes down to the whole question of cremations. That's the bottom line. People are challenging the state's decision to prevent open air cremations.
Oh.
I think if you have an open casket or cremation, where you have the guidelines, the proper guidelines, where you have people around, they are masked properly, you should allow persons to, do their final rites. Because if you don't, you may have that angst about those people now going against the authorities, saying they prevented them from doing their last rites. You may also have that depression where you are not able to do your rites for your father or mother who died, the last rites to them. So you'll have that depression, that anxiety, that anger against the authorities. So I'm thinking any move like that is a move that I think it's welcome. The courts will have to decide, but it has to be decided with the information, the medical information is how could we, it can't be done, it's how we could do. If we're willing to say we have protocols there, we have health persons at that site to be able to, see that the correct protocols that we put into place are met.
I remember chatting with Dr. Ramlachan when she extended the invitation to be the host of this show, and she did say body fluids would stay in the corpse for about 3 days. What happens in the case where cremations and burials take place 2 and 3 weeks after?
Yeah, well, that's the point. I mean, it's not going to be obviously as transmissible. You can still get, I guess, technically viral particles leaving from a body, but obviously the person is not going to be actively respiring because the person has passed away and is no longer, has any lung function. But if you are handling the body, I think there would be a chance. I think if it's a sealed casket or something like that, and it's 3 weeks later, there should be no issue. There's some people actually doing some sort of viewing window on the caskets. There are lots of caskets with windows. There are a lot of plastic being utilized to actually seal the bodies for in funerals like that did in India. I know a few months ago where we all saw those pictures of them burning bodies and pyres in the parking lots because they were running out of space, and they had that huge death toll of hundreds of thousands of people, and they were able to actually allow them to do their rites. I mean, 1 or 2 family members were on site for every single one of those pyre traditional Hindu funerals. I didn't see a lot of the other ones, the Muslim and the Catholics, but I know for sure in the Hindu ones, they allowed them the ability to actually, proceed with, I guess, some of it. I mean, they couldn't touch the real life body, so to speak, but they were able to actually circumvent that. So I think we have to be a little sensitive to that now, as the pandemic is continuing post a year and a half, that we have to allow people to have that type of closure as well too, because that could impact them quite negatively.
So would it be okay if I asked each member of the panel for 30 seconds of some closing comments? We can start with you, Dr. Ramlachan.
Sure. I would just like to say that the impact of COVID-19 pandemic on mental health and of course neurological symptoms of long COVID and even acute COVID is really been understated in the past. And I hope that after this kind of educational campaign that we're on, that some of that information permeates into the groups that are watching it and they're able to actually spread it. And of course, this is going to be live on YouTube. Our past and future panel discussions will deal with a little more sensitive topics in terms of children and COVID and mandatory vaccinations. And of course, a lot of the clinical issues. And I urge people, as I always did, to have your questions, but have them answered by experts. As somebody who looked at a YouTube video for 10 minutes is not an expert. Somebody who went to University of Google and read an article that was published in a newspaper is not an expert. You need to consult your physician. You need to consult well peer-reviewed publications that are actually circulating online. Contact us, any one of our panelists, any one of the previous panelists, any one of the future panelists, and of course through UTT if you have any questions, and we can try to help.
Dr. Naked Chatur.
We have to move towards a healthy society, and vaccinations, that's the way to go. However, we just can't have physical health, but mental health. And we have to attend to the mental health issues of persons with challenges in our society. We have to allow that they need to have some sort of reasoned thinking on the scientific facts and to understand the evidence, so that we, as I said, if we as a community, each one must reach one so that we can allow the society once more to be fully vaccinated and to open our borders. So mental health issues, address these and have community efforts so that most families can access these vaccinations.
Dr. Dayal Singh.
Yes. Well, what I must say is that the enemy has really become misinformation. What we are doing here this evening is to try and, give some truth to some of the facts that we are trying to spread what's good. The message I want to give there, no matter if you vaccinate or you don't vaccinate, we still have to wear masks, even with this Delta strain. So the idea is our whole life change is wear your mask wherever you go. And to the young persons, I mentioned to them, when there was the Spanish flu in America, you had the Roaring '20s. After the bubonic plague, you had the Renaissance where you had that art explosion and anything. So there would be periods after this pandemic where persons now, the young persons, will be able to explore, will be able to excel, will be able to now take the world to a different level. So that's a positive thing I want to tell them. Just bide your time and be safe.
Thank you very much. And if you're hearing my dog, it's because the dog knew that I was ending at 7:30 and we're way beyond 7:30. So he's now reacting. Dr. Ramlakhan Singh?
Well, I'll just close in saying that really the way out of this is to follow the evidence, and the evidence as well presented here tonight is that the way out of this thing is with vaccination. We've got a lot of choices for vaccines, even right here in Trinidad and Tobago, and the reasons for not vaccinating are becoming less and less. So we have to make a positive steps towards getting back to what might be the new standard normal for humankind, and the way out of it is really vaccination.
Thank you very much, all members of the panel. It's been enlightening for me, educational to sit here for this period of time and learn so much. Let me thank the University of Trinidad and Tobago for considering me to be the moderator of this excellent session. Good night and be safe.
Good night, everyone. Take care.
Night.
Good night, everyone.